back pain. Obviously, if you are in a pain practice like everybody is here, you see a ton of low back pain. Doug Beal said this morning at another lecture that this is the decade of the anterior column. So we think about pain in the anterior, middle, and posterior column. The 2000s to 2020 was, I guess, the posterior column. We did facet blocks on everybody, right? The anterior column is really what we're living in now, and probably a lot more of our chronic back pain patients are coming from the anterior column than we ever thought. Prevalence of facetogenic pain has been described as about 20% of low back pain. So that leaves 80% of low back pain coming from somewhere else, and probably a big portion that is the anterior column, whether it's vertebrogenic end plate derived or discogenic pain. So it's been looked at in the studies that have been done.